I'm Dr. Loy Vaughan, an orthopedic surgeon with Alabama Bone and Joint. A total hip replacement is most commonly done for arthritis of the hip, painful arthritis. So a good candidate for a hip replacement is someone that has, number one, severe pain, and number two, usually moderate to severe osteoarthritis on x-ray. And we typically try to avoid big surgeries like this unless we've tried other things. Other options are medications like anti-inflammatories and steroid injections into the hip joint. And if we try these things and they stop working, then the next step is a total hip replacement. And the way a total hip replacement works is you basically open up the hip joint and you remove the top of the thigh bone right here, and you replace it with a metal hip stem with a ball on it, and that serves as the ball part of your hip joint. And then in the socket, you smooth it out and replace it with a metal cup with a plastic liner. And it goes in like this, and then you don't have bone rubbing on bone, you have this ceramic or metal rubbing on plastic, and it doesn't hurt as much. And a total hip replacement is the best surgery in orthopedics. It has the highest quality of life gain from pre-surgery to post-surgery. The most common risks and things that we worry about the most with hip replacements are, number one, infection. It's got about a 1% risk of infection, and if a hip prosthesis does get infected, it's a pretty big deal. You know, you have to take everything out. So we're very careful to optimize patients and try to decrease the risk of infection as much as possible. So certain things that go into that are body mass index, getting your blood sugar as controlled as possible, and there are some other health things that can be optimized to help prevent that. Another risk is differences in leg length. So usually the leg length is a little bit different. We try to make it a little bit longer, but not so much longer that you notice it. So that's definitely something that can happen after the surgery. Blood clots are a big risk, and to minimize those, we usually put people on aspirin after the surgery. Unless they're at higher risk for blood clot, then we usually do some sort of blood thinner for about a month after surgery. Dislocation is another risk of a hip replacement that can always happen, and there's some things that we try to avoid after surgery to help prevent that. The main thing is just avoiding extremes of motion, things that kind of put your hip in an extreme position. But the things that make it more likely to dislocate are hip flexion, so bringing your hip up, hip adduction, bringing it across, and internal rotation, so twisting it in. Those three things, when they're combined and done to an extreme, put the hip at risk of dislocating out the back. And the post-operative course after a hip replacement, typically you stay in the hospital one night, work with therapy, sometimes that day, definitely the next day, make sure you're safe to go home. And usually people go home the next day and start outpatient therapy the day after that. You have dissolvable stitches in the skin and a bandage with a suction on it that helps increase blood flow to the hip. That comes off after a week, and after a week you start washing the incision with soap and water daily, drying it and covering it with a clean bandage until your first post-operative visit in 2 weeks, at which point we take a look at the incision, make sure everything looks okay, and if it looks okay, you can kind of treat it as normal with daily showers and no wound care. We have those posterior hip precautions to try to prevent dislocation for about 3 months after surgery. The further you get from surgery, the less chance you have of dislocating, the more stable things get. There's always a risk, but the further out you get from surgery, the less that risk is. We usually get x-rays at about 6 weeks after the surgery to see how the prosthesis looks, and if there's no other problems, we don't get another x-ray until about a year after surgery. If you have any questions or want to schedule an appointment, call 205-621-3778.